Hello, welcome to the Shattering Glass Ceilings Celebrating Remarkable Physicists second ever video. Today we're interviewing Michelle Nielsen. But before we get started, I'll just introduce myself. My name is Charlotte Ferworn, and I'm a PhD candidate studying medical physics at Toronto Metropolitan University. My pronouns are she, her, and I'll be conducting this interview with my colleague. Ruiyan, do you want to introduce yourself?
Hi, thank you, Charlotte. I'm Ruiyan. I'm a PhD student at University of Toronto, and I'm be helping with the video recording for this interview.
And Michelle, do you want to introduce yourself?
Sure. First of all, thank you for having me. My name is Michelle Nielsen, and I am a clinical medical physicist in radiation oncology at the Odette Cancer Center at the Sunnybrook Health Sciences Center, and I'm also an assistant professor at the University of Toronto.
We're so grateful to have you with us today. We're going to start it off with a question for you, Michelle. What made you want to get into medical physics?
That's a good question, and I got to kind of go back a little bit on that one. Essentially, I liked math and sciences when I was in university and high school, and I like the application of those areas. So not just the pure math or the pure science, I really liked applying them. So a little bit of the engineering as well. So when I went to university, I went to the University of Waterloo, thought I was going to do something within medical science, but didn't know what. So once I found out about the physics applications within medicine, it really piqued my interest. And when I finished my undergrad, I was like, I'm not quite done learning, I don't think yet. So I went to grad school, and I didn't go into radiation oncology physics right away. I did a grad school or a master's program with lasers. So I worked in a laser lab, and I did bulk spectroscopy for breast tissue and looked at the application of that for screening for breast cancer. And then as I was doing that, I was trying to figure out what I was going to do because pure academics wasn't quite a good fit for me. So once I found medical physics, especially in radiation oncology, it just fit. So then I started my residency actually here at Sunnybrook.
And you're still at Sunnybrook. So what excites you about your current role? And if you can describe it a little bit.
So I actually left Sunnybrook for about 16 years, and I worked at Credit Valley Hospital, and that's in Mississauga. But my current role here in medical physics is a senior physicist role, and I do program quality. So part of my role is to work closely across all the disciplines, so radiation therapy, physics, as well as radiation oncology, even into administration, to look for the best way to treat all of our patients that go through our system. So big questions such as how do we ensure that we're using our technology to the best that we can, knowing that we can do automation or we can use interlocks. Let's build those systems and workflows to take advantage of those tools that we have and look for efficiencies and just ensure that our practices are as solid as they can be with the technology that we have. So I really like it because I get to work with the physicists, electronics, machine shop, therapists on the front line, managers, supervisors, all the way across. And we really try to do the best workflows that we can to ensure that patients are treated to the best quality. So it feels rewarding to know that I'm influencing all the patients that are getting treated.
Sounds rewarding. What do you envision as the next steps in your career?
So I've done a lot of work volunteering for different organizations. So the Canadian Organization of Medical Physics. I'm now doing some work with the Canadian Association for Radiation Oncology. I've also been involved with the CAMRT, or the Canadian Association of Medical Radiation Therapists. I hope I got that all right. And so I want to do more volunteering with that and to actually really push that this is a multidisciplinary area of work and that we can do the best that we can when we all work together. So that's kind of one of the areas that I think I want to kind of work on in my career next. I think it's really rewarding, and to actually understand the different perspectives of our interprofessions is really important to me, and I find it rewarding.
And we do ask this of all our interviewees. We're wondering, do you see yourself as a leader? And when did you start seeing yourself that way, if you do?
I do and I don't. I'm not a formal leader in the organization that I'm in, but I feel like I'm a leader in the sense that I can influence the way that we work. And if I can do that, then that is a little bit of leadership that I can kind of pull on. So I do think that I can do that. Also, like I said previously, I've done a lot of volunteer work, and in that space, I've led some novel projects that have had pan-Canadian influence. So I feel like in that sense, getting those going was a space that I could kind of grow my leadership skills, and to keep those projects going really took a lot of work and kind of getting outside of my comfort zone. So in that sense, they really helped me do that.
What is an accomplishment that you're proud of, or do you want to highlight a specific one you've mentioned so far?
Yeah, so you might be familiar with the technical quality control documents that CPQR and COMP have done over the last, I don't know, few years. So there's a suite of those 15 documents that really lay out what the QA can be and the minimum requirements for things like a linear accelerator and what the daily, monthly, and annual QA can be for that. So I didn't write any of those documents, but the framework that they were developed in was something I was heavily involved with. And those documents are now part of a lot of education programs across the country. They do work well with MPPGs and AAPM task groups and things like that. And I'm really proud of that work because, again, it was novel, it was new, and it's something that the Canadian medical physics community can be really proud of, I think.
I think so too, definitely. And throughout your career, what have you seen change in the field?
So I think the technology that we're using and the way that we work with our technology is very different from when I started. So I started early in the 2000s when not all treatment planning systems were three-dimensional dose calculations. We were using Cobalt. We were using simulators that weren't CT simulators. And that's the way I learned. We were also using wedges to shape beams. And we were doing more floor field boxes and things like that. So I think the amount of change that we've seen just in how we can calculate how good our calculations are for our treatments and how much technology and how far that has come and what those distributions for patients currently are compared to before is very different. The way that we work with our technology is also very, very different. Our systems are much more complex and maybe a little bit more of a black box than they used to be when I first started to learn. So that has been huge differences. And I think the way that medical physicists within radiation oncology work within our systems is very different from what it was before.
And in your opinion, what do you think needs to change next?
Oh, that's a great question. I don't know if I know the answer to that one, but I think what will change next is the technology and the way that we work will become more complex. And for us to understand that at a systems level is going to be really important. So not just the basic physics, the foundations that we learn as residents or as you are in PhD programs or anything like that. It's really taking those and applying them to the next level and how they work. Or how that foundational information is used day to day. So really getting more into the computer science, the systems engineering and things like that to understand exactly how we're doing what we're doing is going to be the next level, I think, on top of that foundational information that we need.
Thank you so much, Michelle. Thank you for your time. That is the end of our interview. I do just want to say, we're really grateful you could come.